Good afternoon, everybody. Hope lunch was good, and it's always nice coming after the lunch rush so that everybody's just kind of happy and dozing off a little bit, and that's the perfect time to talk about data and evidence. I also am kind of looking back at the past and thinking, wow, there are some people in this room that are really who a lot of folks I would consider mentors. So it's a real honor for me to be presenting here. And thank you to Helen Buckley and the organizing committee as well. As you've heard, I'm on my way to Melbourne not as we speak, but this is the middle between Toronto and Australia. And I have quite the commute, so I've split my time. I think if anybody has a longer commute than I do, I really feel sorry for you. But maybe we can fly somewhere on miles together. So I'm going to talk about getting through this mess, and I'll talk a little bit more about what that is, perhaps. But most importantly, I want to give a flavor for evidence and its uses in child protection, child welfare, and also think about how we might use the systems that we currently have to both build on them and think about them in different ways, kind of maybe turning it on its head a bit. So some of the ideas, this is shameless self-promotion at its worst. But I do need to acknowledge Rami Ben-Benishti, who we've kind of thought about these things a lot. We put together a book that came out of a meeting of child welfare experts and put together some of this thinking in the book, and you'll see even a chapter or two referenced in the talk. This will be available early next year. Maybe if some of what I say is of interest, you might find more of it in there. But do want to acknowledge Rami as well. And this mess. So I'm reminded of other messes, and we sometimes think in child protection that we have the biggest mess of all, but maybe not. I keep thinking about what the last U.S. administration faced when it came in, and realize that a lot of systems have messes, and it's not necessarily that everything is bad. It's just that, well, it could be a lot better. And these are just some of the issues we face, and I sometimes say things that I regret later, but we'll see how it goes here. Some of the issues we face, I think, in the child protection end of things is that we tend to be residual in nature in child protection. That is, bad things have already happened, and we try to do something about them. Despite the efforts of a lot of people in this room, have a lack of rigorous research, I would say. We don't know a whole lot about what might work and what might not. And even of the things that we do know, the big push lately has been in implementation science, and it turns out that if you have a really good program that's implemented poorly, it doesn't have so much of an effect. And I see a lot of theory-less research. Well, let's try this, let's try that, or let's just use some numbers and figure out whether it works. And the opposite of that, kind of deconstructing everything till the cows come home and we don't know even whether we exist really or not. And that's not to say that some of that thinking isn't good. It is. I think thinking critically about things is crucial. But it sometimes seems we're more interested in theorizing about things than doing things. And we have a big challenge in developing professional expertise in the area of child welfare, child protection. And some of that's seen, and we sometimes have even a difficult time defining what child maltreatment might be. And I also see a lack of attention to basic behavioral principles, and that is, if we look across a whole lot of interventions that we've found to be effective, the vast proportion of them have some element of behaviorism in them. And While I think, yes, behavioral interventions are easier to measure because that's part of what you do with behavioral interventions, that doesn't mean that it's wrong. It just means that maybe we need to measure other things as well. I don't think we do ourselves any favors by saying, well, you know, this other type of research just doesn't lend itself to measurement. Well, okay, but how do we know whether it works? And it's an issue, it's a problem. So I'm not going to give a magic bullet. I don't think there is a magic bullet, but there is a process, and it's a process that other professions have gone through and are going through and will continue to go through for a very long time to come, maybe forever. This guy's, I'm not sure how clear this is, but we're looking for a bold and innovative solution, but I'd settle for a way out of this mess. Meaning we just need to slog forward a little bit. And so I'm going to talk a little bit about what is evidence-informed practice. And I use evidence-informed practice and evidence-based practice interchangeably. And the reason I do this is because some of the originators of evidence-based medicine, from which evidence-based practice and social work pretty much sprung from, would probably have changed their name originally from evidence-based to evidence-informed. And we'll talk a little bit about why in a second. So we have a lot of words. EBP, EBM, EIP, EBPs, ESTs, ESIs, ESPs, PGs, and BPs, and oh my God, what next? You know, maybe there should be evidence-based keynote addresses, I don't know. But it seems we'll come up with evidence-based in front of anything, evidence-based orange juice, for God's sakes, if it'll sell us something. But really what it is something that's very specific. Evidence-based practice is based on evidence-based medicine that came from, from Canada and from England. Evidence-informed practice, I would say, describes both of these things. And what it's meant to be is evidence informs our decisions. Evidence informs our decisions, not evidence makes our decisions. And I think that's a huge distinction. We have things like evidence-based practices. For a while, we had people saying evidence-based practice is using an intervention that was tested and found to be effective in a randomized controlled trial. That is not what the originators of evidence-based practice envisioned. ESIs, empirically supported interventions, these are things, and EBPs and what have you, are practices that we think, or services that we think might be effective. But just using one with a client does not evidence-informed practice make. We also have empirically supported practices. We'll talk a little bit about more about that. And these can be seen as individual, kind of discrete service or practices that tend to be effective across interventions. We also have practice guidelines, and we have best practices, and sometimes these are validated, sometimes these are not, but they're generally lists of things. And if you choose one of the things on the list, that still doesn't make it evidence-based practice. Evidence-based practice is, in the words of Brian Sheldon, lovely guy, the conscientious, explicit, and judicious use of current best evidence in making decisions regarding the welfare of service users and carers. And the model, as it's been adapted to the social work or social care or social services realm, is taking current best evidence, combining that with clinical state and circumstances, and client preferences and actions, and that the coming together of all those things is clinical expertise. So that is a little bit different, I think, than just using a practice that somebody found in some research somewhere to be effective. To give you an example, this is a joke article from the British Medical Journal on the use, and it's an RCT, by the way, the use of parachutes to avoid severe gravitational pull resulting in death or something like that. There are some things that we need RCTs for. There are some things that probably we don't. This might be one of them. But the point is there are different types of questions. And some of them are effectiveness questions. And indeed, we might want a randomized control trial to tell us about whether something works or not. Same for a prevention program. But there are also questions around risk and prognosis. Is something bad going to happen? We have risk assessment tools like that, in fact. I didn't predict that. But whatever it is, it did not sound good. And that's my assessment, which would be another question. And we could look over there and probably describe what we see, and that might be a descriptive question. But descriptive questions might be the basic epidemiological research around, what is the distribution of this type of problem we have in a given area? What are the dynamics within a given population? And this, incidentally, was missing from the original kind of conceptualization for social work by Len Gibbs, who did an amazing job. This is 10 years ago that he produced a book and described what is evidence-based practice. But in descriptive studies, I think we kind of miss what Sackett and company would call the background questions. Like, what do we need to know going forward about this particular issue before we get to effectiveness? But even that, there we go. Well, no, that's not it. There we go. So we're talking about a clinical interaction that occurs in a broader space. And we can't ignore that broader space. And I'm trained in social work, social welfare, and we have a huge social justice mandate, and we also have a lot of systems theories. And we have a lot of ways of looking at things other than that clinical interaction and knowing that a social justice perspective, for instance, is important. So just thinking about that clinical interaction, if I'm not thinking about the context in which it occurs, I may miss far more than I gain by using, let's say, an RCT approach where I think about what interventions are effective with what groups. Who's delivering this service? Do they have the training and supervision to do that? Does the profession kind of ascribe to this particular approach? Will we cause problems if we just kind of parachute it in? Hopefully it would be a parachute and not the control group of that prior condition. We also have an organizational mandate, and that occurs within a political context. And the provision of services occurs within an organization that has resource constraints. These are often dictated by the order of the day in terms of the broader economic picture. And we also have huge things to think about in terms of community. And the community has a socio-historical context. So for instance, some of the work we're doing in the Northern Territory in Australia, well, we're doing a lot of work with Aboriginal communities. And when you think about providing services in that community, you would miss the boat entirely if you didn't think about the history of Aboriginal peoples in Australia and elsewhere, frankly, and all the really horrible things that have been done in the name of child well-being, and we could go on and on. That's a whole presentation, but it's safe to say that we've done some pretty bad things within that community, and now we're going to parachute some other things in there. And it can go even broader, and this is something that we came up with a team where we're basically formulating an evaluation for Australia's framework for the national framework for protecting children. And we had to think about the systems because the framework actually, it's pretty neat. It's innovative, and it flips the usual residual model on its head, and at least philosophically tries to get at providing preventive services, early intervention services, and linked services to families before they actually come to the pointy end of the stick in child protection. And there's a lovely report, a UNICEF report. Fred Wilson and Deb Darrow and John Fluke were authors on this, among some other folks. And they came up with a model that this was derived from. They're probably looking at this in horror, thinking, that's not what I drew. But the bottom line is systems pretty much for children kind of fall within national and regional contexts that include social, economic, political, cultural components. And all of these things will drive the system's values and goals to create the processes and structures that lead to the systems. And these systems, theoretically at least, lead to outcomes, but you can't just look at the child protection system outcomes, because these are linked to juvenile justice, education, health, mental health, and these all kind of form a layered set of systems that, frankly, we all know the same clients interact with. And so it's important also to look at these arrows, because once these systems are created, they create their own cultures which influence things as we move along. So are we just completely in this mess of context that we can't figure our way out of? Well, no, I don't think so. So I think there are processes that we can use to at least muddle through to the next step until somebody figures out something better. How many of you guys have heard the saying, there are different ways of knowing? All us academics are always kind of saying something like this. There are different ways of knowing, as if they were all the same. Are they all the same? I don't think so. I think there are different things to know, right? There are different things to know. And we ought to be asking the questions, and the questions should drive the method. And I would advocate that we need a whole bunch of information from different methods, from different sources, and that all of that pretty much fits in with an evidence-informed practice model. It's just, what question are we asking, and how do we weight what we find? Evidence is not deterministic. It doesn't tell us what to do. It informs us. It informs us. How much does it inform us? Well, what evidence do you have, and what question are you asking? And how can you string these questions together in a meaningful way to start telling the story? But I would say you need numbers. And this is taken from the last election in the US, where President Obama calmly is saying, actually, Mitt, you need numbers to do the math. And I find that sometimes we don't always have the numbers in child welfare, and sometimes we do. There has been a child welfare administrative data revolution led by people such as Fred Wilson, Mark Courtney, Rick Barth, all sorts of really good people, and have created or brought forth, as it were, data from various sources that tell us the story of how kids and families make their way through the child protection and other systems. These are just some examples. And if you want a really nice, beautiful public website, go to the Berkeley website that Barbara Needell and her team have developed. And there are all sorts of lovely indicators and a great deal of information about the largest state in the U.S.'s population of children and families coming into contact with the child protection system. Really, really informative at this kind of higher level. What are we doing? How are things going for these groups of for these kids? It's individual level data, but it's aggregated up that tell the story of, well, how many kids? How many kids are taken into care over time? How long do they stay? Where do they go while they're there? And that's where I came from, and was a bit horrified when I came to Ontario and there was no such system, frankly. People were sending child welfare administrative data to the ministry on Excel sheets. right? So no individual level data, yet spending $1.4 billion a year on child welfare, child protection services. We were seeing an increasingly forensic approach. So every year referrals were increasing, substantiations, entries into care, and this resulted pretty much in a big reform effort to bring in alternative response, yet still no data system. And we also decided to go to an accountability framework without a data system. And there were just few sources of information. And finally, the Commission to Promote Sustainable Child Welfare, which would be directly linked to that $1.4 billion per year, was called and developed a set of performance indicators using really neat methods of like asking other areas, other good researchers and what have you, to come up with what should we measure and how, and then discovered that we really actually can't do that because we don't have a data system. So at some point in the last 8 years that I've been at Toronto, we decided to actually build something that could work in the absence of a system. So the point of this is going to be that there has not only been a data revolution in terms of using data and taking it from the systems themselves and the technology behind them are changing, and they're changing at a rapid pace. And it allows us, if we can get our heads around how it's changing, to build different systems that take advantage of what is there and build something new. And that's kind of be the thread. And it's kind of like we're starting where the client is, the basics of social work. Well, starting where the system is. So we partnered with the child welfare sector, and we created a longitudinal event-level database of children's services in Ontario, not funded by the government, really, but it does follow children through from report straight through to investigation to exit. And the goal for us was to use this information to guide decisions at the policy level. And we did this in a very interesting way. So it turns out we had a bunch of different vendors serving individual children's aid societies. Children's aid societies in Ontario do everything from investigations. They get the call, they do the investigation, straight through to adoption. These are public-private entities that are funded by the government but are not part of the government. And we had all these separate platforms, yet they contained some similar information. So we worked with the vendors and we came up with a way for them to push the data to us. We mapped the data and we came up with a lot of automated processes to do so, and a lot of doctoral students with crossed eyes. And we verified this mapping back, and then we put the results up on the website so that for the first time in Ontario, we've got now 24 agencies in across multiple systems. People are able to tell where their kids came from, where they went to while they were with us, and what was the likelihood they'd come back, and a whole bunch of other things. And it's really neat to sit in rooms and talk about performance indicators now, and what should we be measuring, and really what is an investigation, and what is verification or substantiation anyway, and all of that. But we have something to talk about, and we have data, and we're able to move forward with it. But that doesn't mean we're finished in any way. This is a joke that's commonly found on the internet. You too can use it, but it's theoretically a test for a kid in geometry, apparently. And the question is, find X. And here it is. So you can be presented with information and still come up with a funny but wrong answer. And this isn't just kids. Does anybody recognize what this is? So recently there's been a lot of talk about debt and countries and the likelihood that you would actually be in really big trouble if you ran up a lot of debt. And it was based on one article. And it turns out that the article was based on data in Excel. And these data in Excel were analyzed, and a few cells were missing when the analysis was done. And basically, if you look at this, oh boy, where am I looking? Here we go, there's my mouse. We're looking at the original paper, the blue. And their argument was, once a country hits 90%, look out, the economy is in the toilet. And when you actually correct for the cells that they missed, yeah, there's reason to think that being in debt having less debt is probably better than having more debt, but actually the finding wasn't quite right. And a lot of people have used this article before. Actually, it was found that it was wrong to advocate for certain policies that have, in my view at least, hurt tremendous numbers of people. So it's not just those students. And it's also the way we look at data, and I hope Barbara Needell is smiling. This is a slide that we developed when I was at Berkeley, and it matters how we look at data. Oftentimes we just simply look at how many kids are where, but that doesn't tell the story of how they go through the system. And we need to set up systems in, whether it's child protection or other places in child welfare or really anything, that tell the story of how kids, clients, adults, whoever, move through the system. Because only then can we really ascertain what we might do to improve things. And sometimes cross-sectional data are great, but they definitely don't tell the story. And here's one way that they don't. So what we have here is an example of kids. Each of these lines represents a child. And this line represents January 1st, 2010. That's when we started looking at this group of kids. December 31st, 2011, that's when we stopped looking, so a couple years of data. The length of the line represents how long they were in care. So some kids were here the whole time. They were here when we started looking, and they were here at the very end. Some of the kids came in for a short period of time, and they left some period of time later. Some kids were in when we started looking. When we stopped looking, they had left the system. And then some kids just come in and come out while we're in our observation window. And if we go through time and we stop at any particular point in time, who are we getting? Well, we're getting the long stairs. How many hundreds of articles have been written that look at a cross-section of kids in child protection and say, here's what the kids look like? Well, that's not what the kids in the child protection or in foster care system look like. It's the long stairs, because you're biasing towards the long stairs. You're not picking up the kids that come in and out because they're less likely to be there. When we ask things like, and there are different ways of knowing, when we ask things like, well, what do the kids say? We really ought to ask them. Well, of course we should ask them. Which kids? Which kids are we asking? Are they representative of the system? Or are they the ones that happen to be there when we go looking, when we get funded for our research projects? And the answers might be very different if we actually had a representative sample. Okay, so enough of that controversy. Let's move on to another one. I'm going to stand up here and I'm going to say computer systems are great. They're really good for you, and they help us know where kids are going. And if you're a practitioner, it's probably one of the biggest headaches you've got. There's extreme frustration in the field about data systems, and we are really kind of at the mercy of the systems that are there. But we can create decision support data structures that actually measure things and are useful for practitioners. And I think that's the key that we're missing. We create these things that are not useful for practitioners and that are not empirically based. They don't have, they're not tracking the kinds of things that that are really important to track, like real child welfare outcomes. I guess what I'm saying is there are programs out there that are all encapsulated And they have their own computer systems, and they may be evidence-based. You might find an effect for, let's say, a parenting program. This one's incredible years, has a moderate effect size across a range of studies. And there may be, for some of these programs, a computer system that will help practitioners to actually get their way through providing services, and may even give them information that they can use. But what if you don't have that? What if you have to build your own? Well, the next big movement, I think, in the field is going to be moving away from manualized programs and putting together common elements or effective practices, or ESPs, into strings of ESPs that address certain specific problems. A lot of this has already been done with Bruce Torpeda's stuff and practice-wise. Here's an example of some of the common elements that you might see. One of them would be, say, praise. Praise works in some contexts. These are differentiated from common factors, which are the things that we should all be doing, like empathic response and providing feedback and what have you. But they're specific things that have been found to be effective across a range of interventions that perhaps we can string together in new and unique ways. And there may be even systems that can track outcomes, real outcomes. How are kids doing? Not just whether they reunify or not, using this type of approach. And there are useful rules for building these things. And I think, how many people, just raise your hand, have been involved in a computer system that has cost, let's say, $100 million or more, and it is a complete disaster? Well, how are these things built? Are they built the way things are built in Silicon Valley? And for the most part, I don't think they are. They're antiquated in a sense, and we can build things differently. We can build things that are useful at all levels, at the practice level, so they tell you information that you need to do your job, that they're intuitive, they're web-based, they're secure, they're built modularly, and they are tested as we roll them out. And they contain unit record data. That's not overwritten, darn it. Stop building reports, build data systems that can generate the information you need as reports change. And a lot of these things are built using agile methods. So this is kind of software stuff. And we found that we are able to build these things. We're able to build these things at a fairly low cost. And these things being outcomes and monitoring reporting systems for specific interventions for specific things. And one of them that we've built is still being built and in process for an intervention that is about child neglect, and it's not here, but it's here. This is the Northern Territory of Australia, and we're working with providers who are working with Indigenous communities around issues of child neglect. And I do need to acknowledge the team that's led by Parenting Research Center, Robin Milden, also Vince LaJoya, Cheryl Motka, and also Fiona Arney of the Australia Center for Child Protection. And we have been contracted with the federal government to build a neglect intervention for use by agencies or NGOs out in this area. And what do we know about neglect? Whatever I know about it would say this might be kind of impossible, but it tends not to be. And that we've integrated building a data system within an implementation framework. That is, instead of just building something and parachuting it in, or even asking people's opinion about what should we build and then going away and building it and coming back, we've actively worked with the folks out there to bring together a set of practices and tools to measure child neglect and to help practitioners use that information to change what they do. So it's behavioral intervention, but it cuts across the systems. And it cuts across the systems because we are actually in there with the groups of people that are implementing these, and with government. We all sit around tables and we talk about, well, why might that not work? Why can't we do that here? So what can we do to make that happen? But I think the point is that I'm out of time, and I can't show you everything, but what we had to come up with was a computer system that would take direct data entry, because in the Northern Territory, some agencies do not have a database. So we had to actually give them a vehicle to input data. We have an agency, let's say, that has a computer system. So we work with their vendor to build in our data collection tools. We didn't make them use a whole new data collection system. And that's the key. That was one of the implementation things they asked for. And when you think about this, prospectively, why not build systems that can live in the cloud or that live in an application, rather than creating big systems that go for specific uses and don't go anywhere else, and work with what people have, bridge them together, and then you can even take it up to different levels. So we can pull in social services data, education data, health data over time, and it all lives in a place that's flexible. It's built modularly, and it enables people to actually use information to guide what they do. And I think that's probably where I'm going to end off. That's what it looks like. I can't show it to you. But what I can say is to go back to the evidence-based practice thing, that this whole thing is about information. But it's not just about getting the information. It's about figuring out what information you already have and how it can be used, and then proactively adding information into the systems with the knowledge that those systems, that information, can be built into other systems. We don't have to create things that do everything. We have to create things that are useful. And if we create them in a way that's useful and also modular, so it can be moved somewhere else and it can be adapted, take that knowledge and run with that instead of just building monolithic systems. And that's kind of the way of things. Use an implementation framework to implement them in practice as part of what's done, not as some sort of a thing that social workers and others have to do, but something that is actually useful for them. So with that, I'm going to acknowledge funders and also give a plug for the Joint World Conference on Social Work, Education, and Social Development, July 9th through 12th in Melbourne, Australia. So maybe we'll see you all there. And thank you for being a great audience.